Good afternoon. Welcome to my critical appraisal of clinical technology project. This was completed for nursing informatics and technology class offered at Cedar Crest College as part of the Masters of Science in Nursing program. For this project, I have chosen to review the B. Braun Outlook 400 ES Safety Infusion System. This is a smart IV pump used at Lehigh Valley Health Network in Allentown, PA, to infuse intravenous medications, fluids, blood products, and TPN. For this project, the specific clinical setting is the Neuroscience Intensive Care Unit at Lehigh Valley Health Network. This is where I work, and it is a 14-bed specialty ICU and is part of the region's only comprehensive stroke center. In the neuroscience ICU, there are 45 RNs, and we are all dedicated to giving the highest level of care for stroke patients and other critically ill patients with neurological afflictions. I chose to interview 3 clinicians for this project. First is Kimberly Martin. She is an RN with 25 years of acute care experience. She functions as a staff nurse on the neuroscience ICU. She's a dynamic nurse, always volunteering to take care of the most critically ill patients on the unit. She also does a lot of precepting and is very familiar with titrating medications and using these smart pumps. Second clinician is Bonnie Wazalowski. She has 40 years experience as an RN and currently functions in a dual role as both a staff nurse and in a managerial role. As a staff nurse, she works on the night shift and mentors a lot of novice nurses and teaches them about safe medication administration and titration of critical care medications. In her managerial capacity, she investigates medication errors and counsels nurses who commit them. The third clinician surveyed is Maureen Smith. She's the Neuroscience Intensive Care Unit educator. She has a Master's of Science in Nursing, and she is responsible for educating nurses on all clinical technology, policies, and procedures, and also verifying their competencies. She gave me great feedback for this project. Just a little bit of background. The B. Braun Outlook 400 ES debuted at Lehigh Valley Health Network in December of 2014. Prior to that, we used a different B. Braun infusion pump. This pump also had smart features, but was not nearly as intuitive or safety conscious as the current model that I'm critiquing for this project. Between 2010 and 2012, there were 120 errors involving improper programming of IV pumps. This required action, and pharmacy and nursing got together to develop a medication calculator tool. This tool was integrated into the former electronic charting system and is now integrated into the Epic system that we use currently. Use of the medication calculator tool is considered part of the medication administration policy at Lehigh Valley Hospital. This tool has promoted safety of IV medication administration at the hospital. This is a link to the tool that you will find in Epic and also on the Lehigh Valley Pharmacy Intranet website. There's a med-surg tool, a critical care tool, and a low-level tool. Here is a screenshot. This is the spreadsheet which makes up the med calculator. The nurse inputs the patient's weight in kilograms. She finds the specific drug. In this case, I'll use diltiazem as an example, 125 milligrams in 125 mLs. If she wishes to start the infusion at 5 milligrams per hour, she'll input that into the calculator, and 5 mLs per hour will show as the infusion rate. It is the nurse's responsibility to reconcile the rate computed by the medication calculator with the rate infusing on the pump. Here's a picture of the B. Braun Outlook 400 ES Smart Infusion Pump. It has a number of safety features that I will discuss. The Outlook 400 ES is the only electronic programmable infusion pump in use in an inpatient setting at Lehigh Valley Health Network. B. Braun is the only supplier of these pumps, and they were the vendor of our previous pumps as well. Pumps are maintained by the clinical engineering department, and they are equipped with tracking devices for easy location of pumps, and they're also equipped with dose tracking software, which allows pharmacy to monitor rates of certain infusions. The pump is described as an intuitive pump, which was designed with safety of patients and also of RNs in mind. The pump is equipped with various safety features. The B. Braun website defines the pump as having a brain inside each pump to prevent catastrophic pump failures. Some of the safety features include a numberless keypad entry. It's all arrows, and it's used to prevent manual data entry errors, specifically those involving decimals. There's also a comprehensive drug library that reflects institution-specific drugs and their dose concentrations. These smart pumps have the capability to integrate directly with the EMR and as well as with the electronic barcoding system. However, Lehigh Valley Hospital does not currently have these capabilities implemented, but they are coming. The implementation process of these pumps was fairly smooth. All nurses completed an electronic learning module prior to go live. They also attended a 1-hour live course, which was given by B. Braun representatives. They learned about the pumps, practiced using them, and demonstrated competency. All nurses received a pocket reference guide about the pumps, and during the go live period, there was in-person live support from B. Braun at all times in the hospital. Continued support. All PCSs or nursing educators at Lehigh Valley Health Network are pump super users. Annually at the hospital-wide RN Education Day, there is a pump station where nurses demonstrate competency, and they can also ask questions about certain features of the pumps. B. Braun offers a clinical and technical support hotline, which you can call to ask questions. It is only open from 8 a.m. to 6 p.m. Monday through Friday, however. Another resource for these pumps are our pharmacy and clinical engineering colleagues at the health network and their respective websites. While researching this project, I discovered the clinical engineering intranet website, and they have user guides for all of the clinical technology in use at the hospital. I reviewed the Outlook 400 ES Smart Pump User Guide for this project, and I learned a lot about different features of the pumps. I included a link to this website in my reference page. Here is a screenshot of the pharmacy intranet website, and this includes a link to the medication calculator, and there's some really good information, including the medication administration policy and also the Lehigh Valley Hospital Guide to Administration of Intravenous Medications. Feedback from clinicians about the smart pumps has been overwhelmingly positive. Nurses appreciate the safety features and the ease of use. They appreciate not having to manually program the pumps, and they appreciate the dose guard limits that are featured in these pumps. Dose guard limits have hard and soft limits, which prevent over and under administering medications. These took some getting used to, but nurses now appreciate not being able to overdose medications, as hard limits cannot be overridden. One of the features of the pumps that has been extremely well received is a prompt that each nurse receives when infusing a medication via IV piggyback. When the nurse presses run on the piggyback infusion, a prompt signals on the pump reminding the nurse to open the roller clamp. Previously, doses were missed or delayed due to nurses not opening the roller clamp, so this safety feature is appreciated and has been well received. There is opportunity for improvement. One comment I heard about from both Kim and Bonnie was about the scarcity of the pumps. The hospital does not own as many pumps, 400 ES pumps, as they did the previous models. This has really made all nurses just collaborate and work with the equipment distribution partners and other units so that they have the IV pumps that they need when they need them. The tracking devices come in handy here, and the units really need to work together to make sure that they're sharing pumps. This was a learning curve for us because in the past we got used to having 2 or 3 pumps standard in every room, and now that's not the case. But we're working through it, and we always have the IV pumps that we need to infuse medications for critically ill patients. Another opportunity for improvement was with the battery power. B. Braun advertises that they have 3.5 hours of battery life. Kim Martin felt strongly that this was not the case with these pumps. This is a concern for nurses in the neuroscience ICU because we do travel a lot with our patients back and forth to CAT scan, interventional radiology, etc. We've learned to just be mindful and make sure we keep our pumps plugged in when we're not traveling and when we get to our destinations. Maureen Smith raised the very good point that these pumps are currently an isolated technology at Lehigh Valley Health Network because they are not integrated into the electronic medical record, and Lehigh Valley Hospital is not using the integration with the medication administration barcoding system. These implementations are in the works, but Lehigh Valley recently adopted the Epic system, and it was a huge project which debuted in the hospital in August of 2015. Maureen Smith stated that it was just too much to try to incorporate the smart pump data directly into the medical record at Epic Go Live. Opportunities for improvement and decision making. This again is a collaborative effort between nursing, pharmacy, administration, risk management. When there are medication errors, they are investigated and discussed. Nurses are allowed to participate by participating in unit or hospital-wide practice councils. Significant errors lead to rapid improvement events where the focus is changing the practice to promote patient safety. Maureen told me about a rapid improvement event that is currently underway regarding the smart pumps not being integrated into the medical record. Apparently, some nurses are not accurately titrating their medications in Epic, and this is leading to difficulty with physicians determining exactly how much IV medications their patients are receiving. The incident that she used as an example involved an insulin drip. The titrations were not properly reflected in Epic, and the endocrinologist miscalculated the dose of long-acting insulin that the patient should receive when transitioning off of the insulin drip. Now, this is a two-way problem, as the nurses absolutely need to accurately titrate their medications in Epic. However, this problem will be resolved when smart pump data is integrated directly into the medical record. The rapid improvement event is working on some interim solutions to make this not a patient safety issue going forward as they move towards the next phase of implementing smart pump technologies. Reflection: the nurses that I surveyed feel that these smart pumps enhance their practice and they promote safety for patients and nurses administering medications as well. They appreciate the pumps as being easy to use and designed with safety in mind, and they very much appreciate not having to manually program drug doses anymore. Here's my reference list. Please don't hesitate to contact me if you have any questions or would like some follow-up on this presentation. I thank you very much for watching and listening. Thank you. Bye.